Welcome back to the lecture series on repertories. I am Dr. Kedarnath A. Longani. I am a M.D. Homoeopath. Today we are going to see one of the clinical regional repertory which is based on the part. The name of the repertory is Leaders in Respiratory Organs by E.B. Nash. Dr. Eugene B. Nash, M.D. He was born on the 8th of March 1838 and died on November 6, 1970. In 1874, he graduated from Cleveland Homeopathic College. In 1903, he was the president of the International Hahnemannian Association. He also gave lectures at the Homeopathic Hospital in London in 1905. Now we will see the contribution of Nash. 1. The book Leaders in Homeopathic Therapeutics. Then Leaders in Respiratory Organ. The third one is the Regional Leaders. The fourth one, Leaders in Typhoid. Fifth one, Leaders for the use of sulfur. And the sixth one is how to take a case. This book is dedicated to British Homeopathic Association. This repertory was published in 1909. The total number of remedies present in this book, especially in therapeutic part, are almost near to 130. The total number of chapters in the repertory part, you will find 5 chapters in repertory part and 1 in catarrh part. At the end, you will find repertory to nasal symptoms. Typography. 2 types of typography are used. The first grade given in 1 with in bracket with initial letter in capital. The second grade given as 2 in bracket with small letter. The type of repertory we have seen already, it is a clinical regional repertory which is based on the part. Now this book is divided into 2 parts. The first part consists of short explanation about the respiratory diseases and their therapeutics. So first part is a therapeutics. The second part, which consists of a condensed repertory dealing with the same at the end. So second part is a condensed repertory. Now we will see the part 1, which consists of therapeutics dealing with catarrh, laryngitis, croup, bronchitis, asthma, pertussis, pneumonia, pleuritis, pulmonary tuberculosis. The last one is a cough. The author gives importance to symptomatology rather than to diagnosis and pathology. It is mainly given in ordinary Roman. But the name of the remedy and important symptoms or the part of the sentence which the author wants to emphasize. They are given in italics. Comparisons are given with each remedy, which helps us to differentiate between them. Under the section catarrh, which is the first section, it includes acute nasal catarrh, then influenza, then nasal catarrh are explained in detail. It also contains a short repertory to nasal symptoms at the end of the chapter catarrh. Follow well remedies, dosage and potencies. Even posology is given in few remedies in this repertory. The author included the chapter Repertory to nasal symptoms in the section catarrh at the end. In this chapter, he has purposely not allowed more than 7 remedies to come under each rubric because it would not be advisable to do so. He also arranged the remedies according to their importance, but not in alphabetical order. So medicines are given according to their importance. For example, we'll see dry coryza, no discharge. In the beginning you will find Naxomica, then Sticta, then Lycopodium, Kali Beach, Pulsatilla, then you will find Sambucus. Then nose, discharge, the discharge which is blind. The medicines given are Pulsatilla, then followed by Euphrasia, then followed by Kali surf. All the remedies in this chapter are given in italics. In laryngitis section, he mentions the medicines like in laryngitis, the medicines which are given in the first is a aconite, which has a positive action on larynx. Aconite is indicated in acute form, brought on by exposure to dry cold air or cold west winds. The next medicine is belladonna. Skin seeming to radiate heat. There is a drowsiness with twitching, spasmodic or barking cough. Pain in the larynx. Dark red, turgid face, throbbing carotids, dilated or contracted pupil, sweat on the part. Delirium is common in belladonna, especially indicated when there is a dry soreness of throat. The next medicine we will see aurum tiflinum, acute and chronic form of disease. There is a hoarseness or rawness of throat, can't control the voice, breaks when trying to talk or sing. So dry cough at first, latter the expectoration or accumulation of mucus. Now this medicine is useful in opera singers or public speakers, singers who lose their voice. The next medicine is allium cepa, violent catarrhal laryngitis you will find, accompanied or preceded by characteristic coryza of this remedy, pain in the larynx while coughing, causing the patient to grasp the larynx when cupping, works on inspiring cool air, and especially works in the evening. Aconite will relieve the 9/10 of the cases of catarrh or catarrhal laryngitis or croup as it occurs in northern latitude. It occurs as a result of exposure to dry, cool air, attacking the child in the evening or first part of the night with great excitement, high fever, tossing and grasping for the breath, a little of 12th or 30th dilution, see the posology, in water in teaspoonful doses once in 10 minutes until the child becomes more quiet, and then a longer intervals until the fever subsides. Then we will see the medicine spongia. If cough persists with a rough, croupy sound, peculiar sound of spongia, saw driven through a pine bone, and the stridulous breathing continues between the paroxysms. Spongia is the most important remedy. After the spongia, we will see the remedy Hipar-Sulph. If the cough becomes more rattling but still croupy, as if the mucus would come out of the nose, or mucus does not want to come out, and the aggravation are in the latter part of the night or in the morning, and symptoms are worse by cold air. We know Hipar-Sulph is a chilly patient which strikes the patient. Now here you will find exposure to dry cold air. The Hipar-Sulph is the medicine. Chilly patient. These are the Bonninghausen's 3 great remedies, and with them he had success never before his time attained. Now he gave these medicines especially in 200 potencies. Now for chapter we are seeing, now we'll see the next chapter. The next chapter is the bronchitis. Now we will see the bronchitis chapter. It includes what? In this chapter, you will find especially acute and chronic bronchitis are explained. Then you will find remedies are explained according to the stages of the bronchitis. In the initial stage or in the first stage, especially in the inflammatory stage, the medicines mentioned are aconite, belladonna, and ferrophos. The next chapter is asthma. Here, the author explains the following drugs for asthma, the drugs which are suited for asthma. The first one we will see is ipecac, which has a spasmodic form of asthma. There are violent contractions with rattling and wheezing in the bronchial tubes. Seems as would suffocate from constriction, is worse on motion, and often accompanied with nausea or vomiting. Arsenic has just as severe operation of breathing, is much worse at night, especially 1 to 3 am. Also on lying down, must sit up for fear of suffocation. It is also great on worse on the least motion, particularly on ascending, and is better by warmth. The next medicine is natrum sulph. It has served me well in number of cases, the author says, when the paroxysms were worse or brought on by damp weather. This repertory is very useful in chronic form of asthma. Generally, give it in the 30th potency. This author explains. Lobelia, in addition to the usual difficult breathing, has marked sense of emptiness in the stomach and sensation of lump pressing up into the throat. The next medicine is Aurelia racemosa. With the general asthmatic symptoms, is very prone to come on after the first part of the sleep. The next medicine, important medicine, is a Kalika. Has done beautiful work, especially in elderly people, where the patient has to sit and bend forward to breathe. Cough which is worse at 3 am. Anemia with back-like swelling on the upper eyelid. Then important drug is antimonium tart, often useful or beneficial in the cases that becomes very loose and rattling. You can say the coarse rattling with inability to expectorate, difficult expectoration. Marked relief follows the expectoration. Then the drug is lachesis. Generally in lachesis the attack comes in the after sleep and cannot bear anything around the throat or the chest. Here especially you will find cardiac cases, cardiac asthma. Now we will see the next chapter. The next chapter is pertussis. Now in this chapter it contains therapeutics about the pertussis. Now in pertussis chapter it also contains a name repertory given as in paragraphs you will find. Now we will see the next chapter. The next chapter is a pneumonia. So the next chapter after pertussis is the pneumonia, in which the author explains the remedies which are generally indicated for the first stage of the pneumonia. So first stage of pneumonia, the medicines are aconite, belladonna, ferrum phos and varitum viridi. With the remedies with their dosages and potencies are also given in some sections. The second stage, that is called as stage of hepatization. Remedies mentioned are bryonia, phosphorus, iodine, then comes the rustox, then comes the hyoscyamus, lachesis, sanguinaria, mercurius, chelidonium, antimonium tart, lycopodium, opium, kalika, then comes the carbovage, then comes the arsenic, then comes the sulfur, and then comes the calcareaca. The author explains some auxiliary measures in pneumonia chapter. After the pneumonia, the next chapter is pleuritis. So after the pneumonia, the chapter is pleuritis. Now here the author explains the therapeutics of pleuritis. So here you will find the therapeutics of pleuritis. After the pleuritis, the next chapter is important chapter is pulmonary tuberculosis or pulmonary TB. Here the author Nash explains the cause of tuberculosis. So here you will find causes of tuberculosis. Then you will find the important or main remedies like sulfur. Then comes soranum, tuberculinum, heparsol. Then comes the calcarea calm. Then phosphorus. Then important medicines like arsenic. Then you will find sanguinaria. So these are the drugs which are mentioned. Then the general measures are also explained in pulmonary tuberculosis. Then exercise to be, especially exercise to be taken, abdominal and costal breathing and feeding are explained in the chapter pulmonary tuberculosis. Then after the pulmonary tuberculosis, the next chapter is cough. So after pulmonary tuberculosis, the chapter is cough. Here, the author explains in cough section, the remedies are explained under the, in cough section, the medicines are explained under the following headings. So there is a peculiar arrangement is there. First, you will find the character. So you will find the character of the cough. Then you will find the cough excited by or cough is caused by. Then you will find modalities. First, you will find aggravation of cough. Then you will find the second modality is amelioration of cough. Then you will find the concomitants. So after the amelioration, concomitants, and after the concomitants, you will find general commentary about the drugs, which is also very important. Now we will see the part 2 in this book. The part 2, which is the repertory section, is there. So first part therapeutics and second part is a repertory part. Now we will see the repertory part contains what? Now the repertory part consists of first preface, then chapters, 5 chapters are there. Larynx and trachea, cough, expectoration, respiration, and the last chapter is chest. So condensed repertory you will find. Repertory of the book is not continuous, as the section of nose is given at the end of catarrh chapter, which was present in the first part, that is a therapeutic part. So already that we have seen. The rubrics are arranged in alphabetical order in the repertory section. The first word of the rubric are represented by bold Roman. So first part of the rubric is given in bold Roman, followed by italics. So first bold Roman first part, and second part you will find in italics. If the rubric consists of location, it is represented in ordinary capitals. Medicines in this repertory are arranged according to gradation or importance. It's a very important word is there. So how the medicines are arranged according to the gradation or importance. So medicines are arranged according to the gradation or importance. Sub-rubrics are represented in italics or ordinary capital. Locations as sub-rubrics are represented in ordinary capitals. Conditions, diseases as sub-rubrics are represented in italics. So conditions, diseases as sub-rubrics are represented in italics. Rubrics and sub-rubrics are given as a paragraph in which Sub-rubrics are given in between. In the preface of repertory. So when the repertory part begins, first you will find the preface. The author mentions about the gradation of remedies. So in preface you will find the gradation of remedies. The first grade is mentioned as 1 in bracket with initial letter capital or black face type. Then second grade with 2 in bracket with small letters before the medicine or before the remedies you will find. Now we will see one example. Especially first example we will see cough. In the cough, heated on or becoming aggravation. Heated on becoming aggravation. 1 in bracket, then you will find pulsatilla. 2 in bracket, now you will find bryonia in small letter. Then expectoration, frothy. 1 arsenic, 2 kaliayo. See K again in the small letter. Remedies preceded by figure 1 are of first importance. Remedies preceded by figure 2 are not quite strong but are the same as the verified or italicized type in the repertories. So now we have seen the gradation 1 bracket 2 again in the bracket. All the remedies are arranged according to their importance but not in alphabetical order. So medicines are given according to their importance but not in alphabetical order. The rubrics are arranged in alphabetical order in bold letters and the sub-rubrics are given in italics placed between the remedies. Now, next point. For example, we can see for the above sentence. Now we will see the example. We will see the example of respiration. Respiration. Then you will find the cold. The bracket you will find the breath. Then 1 in bracket. Then you will find the drug camphor, carbovage, varitum. Then below you will find during chill. 1 in bracket you will find the carbovage. So carbovage is the drug during the chill. Now we will see the one more example of, especially you will find in this repertory the cross references. The cross references are given in this repertory. They are given as you will find C. So inverted comma C you will find. For example, now we will see the example of cross reference. Now we will take the example from expectoration. Expectoration chapter. Brick dust color. The expectoration is brick dust color. In the bracket you will find C rusty. The drug mentioned is phosphorus. So C rusty is a cross reference. Another one we will see chest, heaviness. In the bracket you will find C operation. So C operation is a cross reference. In the bracket the medicines you will find aurum, phosphorus and sulfur. The repertory part. This repertory part is divided into total 5 chapters, out of which the first chapter is larynx and trachea. Second chapter is a cough. The first larynx and trachea, second one is a cough. The third one is a expectoration. The fourth chapter is a respiration. So the fourth chapter is respiration and the fifth one is a chest. So last chapter is a chest one. So there are total 5 chapters are there. Now out of these 5 chapters, the first chapter, First chapter is larynx and trachea. Larynx and trachea is the first chapter. This larynx and trachea chapter consists of 31 rubrics. In this chapter, the rubrics are arranged in alphabetical order. In this chapter, the rubrics are arranged in alphabetical order. It consists of rubrics related to the larynx, trachea, glottis, then comes the voice, then comes the cough. It starts with the rubric cough in general, followed by time represented from sunrise to sunset. After it rubrics or the rubrics are arranged in alphabetical order. It consists of 109 rubrics are given in this chapter. So in the cough chapter you will find 109 rubrics. Then comes the chapter expectoration. Now in this chapter it starts with time, followed by rubrics in alphabetical order. There are total 35 rubrics are there in this chapter. The next chapter is a respiration. Respiration chapter is there. It consists of rubrics in alphabetical order. It consists of total 35 rubrics are there. So in this chapter we will find total 35 rubrics are there. Then comes the chapter chest. It consists of rubrics in alphabetical order. This chest chapter consists of locations like lungs, mammary also, heart, liver. It consists of total 42 rubrics are there. So in chest chapter you will find total 42 rubrics are there. Now we will see the different rubrics which are present in the repertory. The first chapter what we have seen in the repertory is a larynx and trachea. Here you will find paralysis of larynx and trachea. The drug mentioned are causticum, alumina, gelsemium, lacasis, plumbum. Then the cough chapter, eyes closing from. The drug mentioned is Hiparsal. Then expectoration chapter, expectoration stringy. 1 in bracket you will find drug Calibich. 2 in bracket then you will find drugs like Coccus cacti and Hydrastis. Next chapter is a respiration. Respiration asphyxia. 1. The first drug is given is antimonium tart, especially in newborn infants. Chest, angina pectoris. 1 mark you will find generally is arsenic, cactus, naja, spigelia, spongia. These are the important ones. Then 2 in bracket you will find ammonium carb, apis, argentum nitricum, aurum, colmia, naxomica, then oxalic acid. Now we will see the special features of this repertory. This repertory is very concise and handy repertory. So this repertory is very concise and handy but very useful repertory. The remedies arranged according to their importance, not only in alphabetical order but they are arranged according to their importance. This repertory has therapeutics in the first part. So first part is a therapeutics, second part is a repertory part which helps us for the quick reference. So after the repertory section you can immediately refer to the therapeutics part for the reference so that you can come to the selection of the remedy. lecture on leaders in respiratory organs. If you like the video, then please do subscribe and share. Thank you once again and see you soon with a new video.